My name is Taylor Dilday. I practice family medicine in Prairie Grove, Arkansas. So I was born in Little Rock, Arkansas. My dad moved up to Northwest Arkansas after he finished his residency. So I actually grew up in Tawnytown, Arkansas for a majority of my childhood. Went to U of A, went down to UAMS for med school, and then did my residency in Conway, Arkansas. Always wanted to be back up here and close to home and family. And so we ended up back in Northwest Arkansas and couldn't be happier to have been able to do that. Yeah, so I'm married with 3 kids. So a lot of my hobbies is, driving to sports appointments and different things that they do. I really enjoy Razorback sports. I coin collect, and really a big thing that we've done recently. Me and my wife has kind of renovated houses that we've stayed in. So the first house we bought was from 1935. We kind of gutted it, from the floor up. And so as we've lived in houses, that's been a big way for me to relieve stress and just kind of do something productive at the same time. So woodworking and kind of carpentry have been a big thing that I've always been into. As a doctor, you get a really unique opportunity to have a relationship with somebody that's just different really than anything you get outside of that patient-doctor relationship. You get to see people on good days. There's a chance you're going to see somebody on the worst day they've ever had. And I think the opportunity to really make an impact in somebody's life, just based on what you do, what you're able to convey to that person, how you're able to care for that person, is just incredibly special, and just something that I love. So another thing that I've really enjoyed is the diagnostic process. Being able to give somebody an answer to a question that they've had for a long time, something that's been troubling them for, their whole life potentially, and being able to figure that out with them, partner with them in their health, and get them a treatment that's effective for them has always been really very rewarding for me. I think a big difference of Mana and anywhere else that I interviewed and any of the other jobs I was looking into when trying to find really a lifelong home to practice medicine was looking for somewhere where you could practice the way you want to practice. You weren't handcuffed by regulations and red tape, and you will be able to treat people the way you were taught how and really reach people in that way. I think Mana does that really well. The other thing that's crucial is just being surrounded by people who care and people who come to work every day in a job that can be really difficult and challenging, with good attitudes, and really try to make an impact with everything that they do. I think that covers a lot of potential pitfalls and things that can become problems when you have those good, solid people around you. And I've just been blown away with the people that work with me. And that has been just fantastic part of Mana, and really, really attracted me to it in the first place. I think a really big part of being a physician is being humble and being a servant. And so that is what I try to remember every day, that, like I said earlier, you're in this really delicate and really cool but unique relationship with people, and it could be their worst day. And I try to be a servant to those people, and it can mean a lot of different things for a lot of different people, but I think if you keep that at the priority and keep the patient kind of the center of what you do, that everything else kind of falls into line. And so that's what I try to do, and I hope that's what people that work with me notice. Yeah, so in Prairie Grove, I think we have the unique opportunity to be in a place where patients don't have a lot of access to healthcare. We have people that drive in from Oklahoma to seek care here, where we're their closest clinic. We have the ability to do x-ray. We have an in-house lab. I think all those things are beneficial to people, so they don't have to drive. Sometimes, once or twice a month they're needing to come to the doctor, and I think that convenience is a really good thing. Just about everybody who works in our clinic are, integral parts of their community. They do volunteering. It's seldom we have a patient come in that doesn't know somebody already in the clinic. So I think that kind of community atmosphere is really unique in Prairie Grove, and I think one of our big strengths.